Hello, my name is Micah Pengitore. I'm a physical therapist assistant here at Prairie Rehab in Sioux Falls, South Dakota. In this tutorial, we will be going over self-MLD for the right lower extremity. This tutorial is to help increase your technique for your home program that has been already developed by your physical therapy lymphedema specialist. Before we begin the demonstration, we will be reviewing the lymphatic draining pathway, hand placement, hand pressure, stroke pace, and lymphatic node sites. First, draining pathway. Draining pathway all ends up towards the heart. After it goes to the heart, it is then urinated. Second, hand placement. I'm going to review on the arm, but when I'm reviewing the arm, it's the same purpose as when you do this to your thigh or to your right, to the lower extremity that you're working on, which is the right lower extremity we're working on in this tutorial. So, I'm going to review here. What we want to do when it comes to hand placement, make sure that the palm and the thumb are not involved and that just the fingers are involved. We place that and we have full contact on the surface area of the skin that you're working on. Next, pressure. We don't want to have too much pressure. If we put too much pressure, as you can see, red marks are developed. That means that we're going too hard with our pressure. The pressure needs to be light. Next, we want to make sure we're going the direction and purpose of the stroke that we're doing here. So we do a perpendicular stretch. And the same thing goes for the leg. It would be a perpendicular stretch this way or a perpendicular stretch this way or this way. So now give it a purpose direction. So stroke over and up. We also want to talk about pace. The pace that we're going to go at is a 1, 2, 3 pace. So 1, 2, 3, 1, 2, 3. 1, 2, 3. As you can see, I'm directionally purposing going upward towards the heart. 1, 2, 3. 1, 2, 3. All right. After going over that now, we're going to go over the node sites, guys. So node sites. We have the cervical nodes, the armpit nodes, and then we have the groin nodes. Whatever site that we're doing, which is the right lower extremity today, you do not stimulate that side, because that is our involved side. All right, guys. Now we'll go through the demonstration. I'll be first doing this in sitting, and then we will actually be doing most of it in sitting. Last thing I want to talk about before we start is that MLD is done on the skin, and you can use a little bit of lotion to increase that tackiness. So when you do that skin grab, that you are able to keep that good contact. All right, let's start off with this, guys, here. All right, breathing. Start off with 3 big breaths of diaphragmatic breathing. So breathe in. Next, we do 10 stimulations up here. I'm going to take off this so it's out of the way. Also want to talk about if you do have any rings around on your fingers, then it'd be good to take those off because you want to make sure you have good contact on the skin when you put it on. All right, cross your arms over here. 10 pumps. You're going to find that dip right above your collarbone. That's where your fingers go into. 10. 1, 2, 3. 1, 2, 3. Keeping that same pace. Mild to moderate pressure, not really hard. 1, 2, 3. 10 here. Doing the neck. 10 here. Good contact. No palm. No thumb. Then 10 here. If you have the wrist mobility, you can do both at the same time, but I do not, as you can clearly see. Then doing the armpits. 10 here. 10 here. Remember, we don't stimulate the sides that is the lower extremity that we're working on. or the site that we're working on. So when you do the opposite side for your groin, you want to make sure you're right along that groin padding, that padding line or underwear line. So you come right along here. I'll stand for this portion. Stimulate here. Still 10. On this side as we do that. So now we need to give a directional pathway for all the fluid from this leg to go. So we want to go 10 or 5 to 7 strokes upward here. 5 to 7 strokes this way, guys. And then coming across, I'll stand, 5 to 7 strokes. Just remember, this is all on skin. Five to 7 strokes this way. Now that we have our pathways going up and across, we will begin with the demonstration of the MLD, self-MLD to the right lower extremity. When doing this, it all depends on, I want you to make sure you're comfortable. You can have a chair here, like I have over here, so you can place your leg on here, or if you have the flexibility, you can also do it here and come all the way down too. But whatever's most comfortable, as long as you're comfortable, okay? For me, I'm gonna put my leg up here. So what we'll do is when you do this, you can do one hand at a time for that 1 through 3 pace and the surface area contact. And then one hand on this side as well. Or you can do doubles. Stimulating here. And then you can do one hand underneath. And then one hand on top. Or you can do doubles as well. Whatever you're confident with, and you're getting that good contact and that good pacing. Next, you want to stimulate. There's a very specific, I guess you could say, site on the medial portion of your knee here that you want to stimulate as well. 5 to 7 strokes here. Next, going down the leg here, we're going to go on the sides here. Five to 7 strokes. You can do one side at a time as well with this. Whatever's comfortable for you. And then don't make sure to forget to go underneath. 5 to 7 strokes per side of the leg. Now I'm going to take my shoe off just to demonstrate for the foot too as well. So you want to do each toe individually. Because swelling does go into the toes. Doing little circles on the toes. Going upward. So little circles, 5 to 7 strokes per toe. And then use the opposite hand on the foot here. Keeping that 1, 2, 3 pace. 1, 2, 3, 1, 2, 3, 1, 2, 3. And then don't forget the ankle, because a lot of the fluid builds in the ankle. 1, 2, 3, 1, 2, 3. You can do one hand as well. You do one hand per side, or you can do double one as I showed you in the beginning there. Now that we've stimulated the whole entire path, now we go all the way up the foot here. Right in again. Remember, this whole process here is 5 to 7 strokes, so all the way up the leg. want to forget that calf though. Five to 7 strokes all the way up the leg. Alright. After you've done the lower extremity, we need to give it a pathway again, clear the pathway again. So we're going up. I'll do this in standing. 5 to 7 strokes. All the way up. Going across. 5 to 7 strokes. And then ending on the nodes and then the deep breathing. Going across. 10 pumps here. 10 strokes here. 10 strokes here. 10 strokes here. 10 strokes here. And then 10 strokes here. Stand for that right at the groin line, panty line, underwear line. And then finish off with the breathing. Three breaths will be suffice with that. Alright guys, for any questions, please contact our lymphedema specialist at 605-334-5630 or visit our website at prairierehab.com. Thank you for watching.